I think something that I've noticed throughout the pandemic is that people have often stated that, or made comments that made me think that they think that COVID-19 is a binary issue. Either you survive or you die. And that's not the case. There are a lot of long-term ramifications that come with this infection. And the vaccine will prevent those long-term ramifications. So it's not only preventing death, it's also going to prevent any issues that arise from infections from this novel virus. And so I think that that's a really important consideration to make when considering whether to get vaccinated or not. As for the time in which it took to develop this vaccine, like I said before, this was an unprecedented response by pharmaceutical companies and biotechnology companies. mRNA technology has been around for a very long time, but never before has a vaccine had this much money and effort thrown into it. And so I think that that really lends itself to how great the science was. And it was actually still a very thorough job done by the scientific community.
Yeah, and in terms of development, we were able to, like Jon said, throw so many resources at this that it was really unprecedented. But we were also able to, take other research that we know from other SARS viruses and translate that into, the SARS-CoV-2, which is, COVID-19 as we know it. So that was another way we were able to expedite this process, taking the things that we knew and, science is getting better every year and basically every day. So I don't think that, this process should be looked down upon, but it should be like, wow, this is how great things could be if we gave, public health, preventive medicine, all of these things more opportunity and more funding to grow and actually do its part in our community. Of our budget in the US, 17% of our budget is dedicated to health, but only 3% of that budget is dedicated to preventive health. So, that's one major critical issue that we have going on right now. And, if all of that was changed sooner than, this crisis, maybe things would have been different. And maybe we would be developing vaccines more quickly in the past. So that's a good point to bring up too. Oh, and I was going to say, history tells us that, other vaccines throughout history, most of their, substantial side effects show up within, 2 weeks to 2 months of the vaccine, being rolled out to humans. So, with Johnson & Johnson, it happened in 2 weeks, and then we, stopped it, evaluated it, assessed the situation, and understood the risks. And, the risks did not outweigh the benefit. And that is one critical thing to be thinking about. Now the Pfizer vaccine has been, being evaluated for almost 6 months now. And we're in a really good place that we're almost certain that the Pfizer vaccine is going to be, FDA approved. So just another point to bring up.
I want to piggyback off something Will said real quickly, because he's brought up the Johnson & Johnson pause twice. And that is the likelihood in which someone has an adverse reaction that those 5 people had is consistent with the number of people in the United States that also have that as an underlying condition. So that should give you confidence that the FDA is paying attention to what is going on and any of the adverse side effects that are occurring, but also that when you do see some scary things like that, you need to take into account that these things also happen in the general public, irrespective of whether a person has been vaccinated or not. And so it's important to think about statistics in that regard.